My name is Doug Tannas. I'm the palliative medicine physician at IU North. Palliative care is really about being an extra layer of support for patients and for their families when there's a difficult situation, a complex illness, a serious illness. Hospice is a form of palliative care, but it's not the only form of palliative care. Hospice is certainly all about focusing on comfort for people who are near the end of their lives. And that's a wonderful thing. But there are also people who need additional support before that. Even as they're continuing to aggressively treat an illness, people sometimes need help managing symptoms, they need emotional support, sometimes they need to talk through questions about what they want to do. That can happen right after a person gets a diagnosis, it can happen during their treatment, or it can happen much later in the course of their disease. Probably the most common thing that I do is to help talk people through the process of making decisions. As their care becomes more complex, there are often difficult decisions to make about how aggressive to be with treatment or which choices to make with treatment. And that can take a lot of time to discuss. So sometimes I spend hours with patients and their families talking through options and figuring out what their goals are and how we can help them meet their goals. I originally came to IU in 2003 as a resident in emergency medicine. And after residency, I stayed within the IU system and was an ER doc at several of our smaller hospitals. But in 2018, I basically switched careers and I re-entered medical education as a fellow in palliative care from 2018 to 2019. And then from 2019 forward, palliative care has been the only thing I do. Although there was a lot that I enjoyed about being an emergency physician, I was really drawn to palliative care for the opportunity to make those connections with people, especially people in a moment of crisis who really need patient, thoughtful listening and support. It's really meaningful for me to have the opportunity to connect with people on a very intimate, personal level and to connect with their families. I may not have cured their disease, I may not enable them to live a long time, but I feel like every day I'm able to help people feel better. It's really rewarding for me when I feel like I finish a conversation with a patient and a family and they understand what's going on better and they feel that they can trust us as a team to act in their best interests.